This is emerging data looking at dogs in general practice, taking radiographs of them, evaluating them for pain, and actually talking to owners. And what it's coming down to is if we ask owners the right questions, they can tell us about those intermittent, short-lived episodes where their dogs have limped but have gotten better. And everybody thinks it's no big deal, but those are probably dogs at risk that we need to really be paying attention to. And the other part of that is that we used to just think about breeds at risk. But as it turns out, this 40% of dogs covers breeds at risk and breeds that we don't typically think of at risk. So osteoarthritis is much more prevalent than we've ever thought. And so it is true, we are typically not treating these dogs for years and years after the onset of their disease. So it's important that we really question owners, for primary care veterinarians, at every vaccination, have you noticed that your dog has limped and then got better? And that for maybe 40% of dogs, the answer will probably be less. And then it's time to say, we shouldn't ignore this. Like, we should start paying attention to this. There's some early interventions that we can start making. Now, when we talk about cats, we know that 90% of cats greater than 10 years of age actually have radiographic appearance of arthritis. But the progression in cats is different. Young cats typically do not have arthritis, and the incidence of arthritis actually progresses as cats age. And we may not be asking cat owners the right questions, and as a result, we don't get the right information. And so a lot of cat owners just think cats don't jump because they're old cats, but we know that cats develop arthritis kind of in a different time frame than dogs do. In dogs, the signs and symptoms associated with arthritis progress, but most dogs are starting out really as young dogs with arthritis. And so the rhetorical question that I like to ask is, are you treating all these patients? Like, this is a huge number of patients that really need to be assessed, treated, reassessed, and to recognize that osteoarthritis is no different than any other disease in that we have to pay close attention. You can't just throw an NSAID at them and say, see you in a year. Like if you had a patient with some cardiac disease or renal disease, we would never do that. And so it is important that as osteoarthritis patients age and the disease progresses, disease management gets more and more complicated. And that's no different than any other disease. I really like to emphasize that. So we're going to talk about some osteoarthritis pain management strategies.